You mentioned the Prime Minister a couple of years ago talking about those promises. Also, a couple of years ago, we were told that if we left the European Union, we'd be saving £350 million a week that go to the NHS. You're far better at sums than I. I've done a couple here. That's tens of billions of pounds we've saved. Where is it? Why do we need this additional funding now we've left the European Union?
Because despite all the extra money that's gone into the NHS even before the pandemic and the money that's continued to go in, because of the impact of the pandemic, it hasn't been enough to meet the challenges.
State, 350 million, and also, of course, noting that you're a former Chancellor of the Exchequer, so you're far better at sums than I. £350 million a week since January of last year is tens of billions of pounds. Why isn't that bailing out the NHS? Or is it another lie from Boris Johnson, just as the lie in his election manifesto? There is no £350 million a week. There are no promises. You cannot believe a word that comes out of a Conservative's lips. Secretary of State.
Not at all.
Well,
so
where's the 300? Tell me where that 20, maybe £30 billion is. I can't seem to find it. You're both Secretary of State for Health and a former Chancellor. Where is it, Mr. Javid?
Allow me to answer that question. As we've left the EU, it happened at the same time as the global pandemic, and that money and much, much more has gone into the health and care service. So we have seen in the first year of the pandemic, with the government put in an additional more than £40 billion, so much more than the figure that you focused on because of the pandemic. In the first half of this year, just this year alone, we've put in £29 billion more into health and social care. Just on Monday this week, I announced an additional £5.4 billion for the second half of this year. And now we're announcing this package for the long term. So the money has gone in. And where has it gone? The answer to your question, so much of it, as your listeners will know, has gone into dealing with this pandemic. So those vaccines, those 90 million jabs, that's where it's gone. The extra PPE, that's where a lot of it has gone. The testing and tracing service, where we're spending £15 billion this year so people can get tested before they meet their loved ones. If they don't feel well, they can then make sure that they're isolating and not infecting others. That's where it's gone also. So, we're not hiding any of this money. It's going into the health and care service. It's being used, a lot of it rightly, to deal with the pandemic right now. But we need to plan for the long term. And that's what yesterday's announcement was about.
So we're £407 billion already due to COVID. Thank goodness for Brexit, otherwise there'd be an additional £30 billion then, Secretary of State.
Look, I think we are fortunate as a country that we can actually afford to support our NHS, support our care service. Of course, that support comes from hardworking people through their taxes. Even when we borrow the money, everyone knows that's not sustainable for the long term. I mentioned that because some people in Parliament were saying, we understand you need this money for the NHS. We also want more money in adult social care, but why don't you just go and borrow it? That's not the responsible thing to do, certainly not for a Conservative government.